Stefania Centrone, she asked me to give a talk about my research, and that was really a challenge for me. I must say, looking back into my past as a researcher, to bring all that in a, how can I say, in a somewhat more convincing order, it took me a lot of time during my holidays. But I did it now, and now I'm satisfied, at least for myself, that I have done that as an elder researcher. Before going into research, I would like to mention here that from 72 to 74, I've been working as a young doctor in Istanbul and in Yugoslavia, and that was really one of the greatest experiences in my life. Non-Western cultures and other political systems, very important, I think, to experience that. And of course also establishing wonderful friendships and family bonds. For example, my wife has been born in Sarajevo, father family Muslimic, mother's family Catholic. So Muhammad and Maria, very special experience. Now I'm coming to my research at those universities, Freiburg, Essen, München, and the motherheads of my research cosmos are pharmacology, pre-implantation mouse embryos in vitro as a stem cell model, then radiation biology, clinical radiation oncology, and since a couple of years, for example, also together with Klaus Mainzer and together with Professor Nerdinger, the topic of sustainability. I will talk on that towards the end of my talk. So let me start. In 1976, at the Institute for Radiation Biology at the University of Essen, I established very, very early, I can say, the system of pre-implantation mouse embryos in vitro. You see it here. We observed, for example, the embryonic development from the fertilization of the oocyte over two-cell stage of embryos up to the hedging blastocyst. That means a time period during which in vivo the embryo would implant into the mucosa of the uterus. So embryonic development. But we did a lot of experiments with radiation, X-rays, neutrons, tritium, and in a subset of experiments we combined the influence of irradiation with pollutants such as lead or cadmium, etc. And we found out when combining radiation with pollutants that we had no supra-additive effect. I can mention here as a clinician too that when combining radiation with chemotherapy or other chemical substances, no supra-additive effect. I think it's a very fundamental but important discovery. With regard to this experiment, we irradiated the embryos in the two-cell stage in vitro in different cycles of the different phases of the cell cycle. And then I did microsurgery. I implanted these two-cell embryos into surrogate mothers. You see it here, a little scar. And then we looked for the outcome, and we discovered, or that was known, I should say, that there's really a all or none law. That means either the embryos after irradiation in the pre-implantation period survive or they don't survive. No true teratogenic effects. A further important discovery was that in this beautiful system that there is a quantitative relationship between chromosomal damage, micronucleus formation. We looked also into true structural chromosomal operations, but there's a relationship between the chromosome damage and the amount of cell death, so that were investigations going into the mechanisms of cell kill after irradiation, which, by the way, is of course important in radiation oncology, cell kill by radiation. So in this time period from 76 up to 84, I could do the habilitation in radiation biology and in the other discipline of embryology. My teacher or mentor at that time, a chemist, Professor Streffer, now 90 years old, and my first clinical teacher, Professor Scherer, unfortunately not anymore alive. Where are we standing today with regard to pre-implantation embryos? In vitro fertilization is established, a procedure for successful pregnancy. The first baby was Louis Brown in England, first retort baby. That was, of course, a most remarkable medical breakthrough in the 20th century. So that is established. And with regard to ethics, I would like to come only to this one point, that a couple of years ago, a Chinese scientist did an in vitro fertilization, and he used the CRISPR-Cas system, insertion, removing, silencing of genes. And the first genetically modified HIV-resistant twin girls were born after this technique. This Chinese scientist has been in prison for 3 years, about 3 years. He came out last year, founded now a private company, and is continuing with his research because he thinks that in the future this will not anymore be unethical. We can discuss of that. And he's continuing, and it is also worthy to mention that these twin girls, two twin girls, they are alive and in a good health condition, in the age of about 3 or 4 years. So it's interesting. There are other points, I will not touch them now. Then when I had switched to Munich in '92 at the Technical University, a very important example for myself, maybe also for science, was our work in the Cluster of Excellence, Munich Center for Advanced Photonics, and at the Center for Advanced Laser Applications. Ferenc Krauss, who got the Nobel Prize last year, and myself, as co-speaker of the cluster, we were able to bring for the clusters of excellence 2 times 45 million euro to Munich, and for the CALA project, Center of Advanced Laser Applications, 64 million euros also to Munich within the Hochschulbauförderungsgesetz 91b. Maybe you know a little bit about that. So we did a lot of research coming from physics, from engineering, but also from biology, medicine, chemistry, etc. And the vision of the cluster of excellence was improving cancer cure by early detection of non-metastasized tumors by liquid biopsies and by imaging and by having discovered and by pointing onto the tumor single-shot radiation treatment with protons or heavy ions on the basis, as I mentioned already, of laser physics. So a small volume for irradiation, safe procedure without significant side effects. And I show you a few results on that. Maybe before I should say that protons are very interesting for clinical radiation oncology because due to their physical properties, namely the Bragg peak, they are a kind of radiation which is sparing normal tissues better than photons and X-rays. Therefore, with regard to sparing normal tissues to do a safe radiation treatment, it is a good kind of treatment. But nowadays, we have conventional protons devices worldwide, several of them, and the technology and all that means a room program of about a football stadium. But on the basis of physics, laser physics, and we could come down to a room size program. So that was our vision, one device for early detection of the tumor, early detection, non-metastasized tumor, and with the same device also, so it's a vision, I must say again, irradiate and cure the tumor. But the difference is that with conventional proton therapy, which is done already during the modern times, you apply the dose per session 2 gray in about 1 second, whereas the laser-based proton therapy would mean you give 2 gray in a nanosecond range. That makes a difference of a factor of 10 to the 8. And this factor corresponds to an application of a 3-year event in only 1 second. And that was interesting with regard to asking whether that makes a biological difference with regard to cell kill, DNA damage, etc., etc. And we investigated a couple of endpoints. By the way, first I should mention we did a proof of principle experiment. So we had pulse protons for an in vitro investigation in carcinoma cells. That was a proof of principle experiment which has been done and published. But then we looked into different endpoints, even into in vivo tumors of mice. And for example, considering this endpoint, that means DNA double-strand breaks and the repair of DNA double-strand breaks. And when altogether we evaluated that, we found that there were no significant differences in the biological effectiveness between pulse protons and continuous protons within a second versus within nanoseconds. Maybe an interesting result, at least an important result with regard to the future of this pulse protons of the basis of laser physics. Now I'm coming to my clinical research in patients, first during the Essen time, then later on in Munich. And I would like to mention here that I aimed for overcoming the biological resistances in malignant tumors by innovative technologies. That meant investigations on the pathophysiology of individual tumors, blood flow in the tumor, oxygenation status in the tumors, in patients, not in experimental models, in patients. Then multimodal imaging, the methods are listed here, and visualization of tumor biology. Then advanced planning algorithms for personalized computer-based radiotherapy. And finally, new radiation techniques such as radiosurgery, stereotactic radiation treatment, intensity-modulated radiation therapy with photons, etc. And here I give you, with the upcoming slides, a few results. So we looked into the blood perfusion of tumor subvolumes in patients, for example, in recurrence in pelvic tumors, recurrences of rectal cancer. And we compared 3 methods: dynamic CT, dynamic MOT, and we used also a mathematical model considering temperature gradients within hyperthermic treatment. So we had the possibility to compare these 3 methods. And what we found was there's a heterogeneity of blood perfusion in individual tumors, and the malperfusion of the tumors was observed especially in the tumor centers. We did such investigations also in experimental models and could see that also in experimental models, the heterogeneity. Now, coming to the question of chemotherapy, medical treatment of tumors, and the radiation oncologists in many clinical settings are combining radiation with chemotherapy. We ask ourselves, what is the effectiveness of anti-cancer drugs in malperfused tumor regions? Do the substances reach the targets in sufficient concentrations? And I would like to mention here that unfortunately, until up to now, there is not systematic research with regard to that in patients, although that is a very important question, for we need answers, more detailed answers. And we brought out this book in Springer Verlag on blood perfusion and microenvironment of human tumors. Then I'm coming to the field also of hypoxia as an example within the field of personalized radiation treatment. It is known since a very long time already that hypoxia of tumors, so malperfused tumors, hypoxia, means radioresistancy. So the sensitivity towards X irradiation, photon irradiation, is depending on the PO2, on the partial pressure of oxygen in a tumor. And if there is hypoxia, the tumors are more radioresistant when compared with normoxia of the tumor. And we investigated that very systematically, invasively with a needle electrode technique. I go not into the details, but we were, I think, one of the first groups who, in cooperation with colleagues from nuclear medicine, visualized non-invasively hypoxia in tumors by the method of positron emission tomography with markers, etc. And here, that is a patient suffering from a hypopharynx cancer. And that you see that in the upper part of the hypopharynx cancer, there is a high concentration of a marker which is standing for hypoxia. And on the basis of that, we developed techniques still at that time theoretically. We developed techniques to concentrate an extra dose within the radiation treatment on this hypoxic part of the tumor. So we left the how can I say, the dogma of the homogeneous dose distribution, and we came to inhomogeneous dose distributions basing on tumor biology, basing on the individual tumor biology. Okay, now I'm coming to stereotactic radiation treatment, which has the advantage of less side effects and better local tumor control, high dose per session onto the tumor, into the tumor, and that is leading to good local tumor control. But as the procedure is done with stereotactic techniques, it is linked with not too many severe side effects. That was a lady with a breast cancer metastasis in the pons region, a very sensitive region in the brain. And you see the images from 2004 when she presented before treatment, and 8 years later in 2012, no tumor to see here. That is really like a wonder. Normally, a patient with a brain metastasis, especially also in breast cancer, would not survive, but she is still in a very good condition, very good condition. So we did pioneering work with regard to stereotactic radiation treatment in early lung cancers, glioblastoma, brain tumors, recurrences, liver and brain metastases. And we also tried to measure quality of life and tumor control in prostate, breast, lung cancers and brain tumors. And this is maybe with regard to stereotactic treatment, very, very important. These were very important publications. We did in 90 patients, 57 up to 90 years old. We did stereotactic radiation treatment in lung cancers, but in early stages of lung cancers, T1, T2 categories, not metastasized tumors. And for example, here you see the tumor, and after 18 months, here No more tumor, no more tumor. 18 months after stereotactic radiation, or here, stereotactic radiation. And these are the results. And let me go on to cancer-free survival results for these two early groups of lung cancer patients. There was, after 81 months, so after a period of 5, 6, 7 years, survival rate at about 80%, a little bit less. And these are very favorable results which are comparable with surgical outcome. The advantage for the patients, especially the old patients, is they didn't have an operation, no invasive treatment, and treatment with radiation, and really very convincing results. So I'm coming now to our contributions for today, radiation oncology. I would like to say that stereotactic radiation treatment in brain, lung, liver is established. It is done in all the modern centers of radiation oncology, and especially also in lung cancers, but also, and I always should say, in early stages. Problem of lung cancer is that mostly lung cancers are discovered too late. That is a true problem. But in early stages, you can cure the patients with stereotactic radiation treatment. We contributed to the multimodal imaging and personalized radiation treatment planning and inhomogeneous biology-driven dose distributions within the target volumes by intensity-modulated radiation treatment. And we could improve cancer cure rates. Now, I should say, when coming to the laser-based early tumor detection and particle radiation treatment, that is still preclinical, I must mention here. There are ongoing global research activities by really excellent groups. Also the group of Ferenc Krauss is continuing in this field, especially with regard of early detection, but also Franz Pfeiffer, professor at our university in physics, and but internationally also other excellent groups. Now I'm coming, my retirement was in 2014, and after that I became how should I say, the speaker of the Senior Excellence Faculty of our university, and with colleagues like Klaus Mainzer and Winfried Nerding, I mentioned that already, we were able to go deeper into the field of sustainability, but again within the interdisciplinarity of our university. And these are the books we have, which we brought out during the last years in this field of sustainability. For example, with Klaus Mainzer, Denkanstöße für die Zeit nach Corona, and with other strategies for sustainability of the Earth system. And the last books are Circular Economy. And I would like to mention also this book, The State of Design, together with you. And we are just working on a book. All these books are basing on symposia we had in the Vorfield, and during which we discussed all these topics very intensively, not only with scientists, also, for example, with people coming from entrepreneurship. And the newest book on which we are working now is entitled With Novel Nuclear Technologies Towards a Greenhouse Gas-Free Basic Energy Supply. Very interesting discussions in relation to this topic, as you can figure out. I would like to mention also briefly that here at the Institute, from about 80 focus groups working in 2023. A focus group means an international fellow with a TUM professor and a PhD student. So funding means PhD student for 3 years, then funding for consumables, and the prize money for the international fellow. So within about 80 focus groups, we have a pretty high number of nearly 50 focus groups, which you can bring into a relationship with the SDGs of the UN. And this is shown here, the different topics. And in 2022, that is shown here, we could sign a contract between our university and the Nobel Sustainability Trust. That is Michael Nobel. He for a long time was the head of the Nobel family in Stockholm. And that is our president, Thomas Hoffmann. And the most important point in this contract is that we at the IAS are leading the selection process for the Sustainability Awards, which are based on nominations. We are leading the selection process of the awardees. And in the last year, we did it the first time. And the prize winners are here, Professor Elena Bu, Spanish lady, and Professor Lord Nicholas Stern from London. He got the prize for leadership and implementation, and Elena Bu got the prize for the field of energy research and implementation also in the field of energy. And this year award ceremony, last year we had the award ceremony at the Bavarian Academy of Sciences, and this year we will do that at Berkeley University in San Francisco. By the way, we have already selected 3 prize winners, but not official until now. Okay, I'm ending here with many thanks to the cancer patients whom we have treated in a curative and palliative intention. I'm thanking to wonderful colleagues, included international partners. Professor Herman Suit was for a long time the director of the Department of Radiation Oncology at Harvard University, a wonderful man, unfortunately not anymore with us, died a couple of years ago, really wonderful man. And this is my Essen time and Munich time, etc. So I thank them very much, and I thank, of course, also the institutions from which we got the money for our research. That is my final slide. Thank you for listening and that you gave me the opportunity, especially Stefania and Roberta, to present my research in this workshop dedicated to the great philosopher Leibniz. And for myself, I'm really not an expert when coming to Leibniz. However, I read a little bit about him, and so for me personally, one conclusion was that die Ganzheitlichkeit des Denkens von Leibniz und sein Traum von einer auf Zahlen basierenden Logik sind Ansporn. Zahlen, finde ich, sind enorm wichtig in der Forschung. Wir müssen auf Zahlen basieren. If I can end so in German language. Thank you.